When I'm discussing with a patient third-line therapy, there are a number of factors we consider. First of all, we want to know what the person's wishes are in terms of aggressiveness of therapy. Some people have had quite a bit of treatment and need a break. They may not want to take any more treatment at all. But for those people who want to, we take into consideration their functional status, their activities and hobbies, the previous side effects they experienced with chemotherapy, their concern about future side effects. We also have a discussion about the pros and cons of using the two different available drugs and explain the different side effects just so that they understand the differences between them. Along the lines of biomarker testing, I think it's important to point out that KRAS status does not affect the ability to benefit from either of the third-line options, regorafenib or trifluridine-tipiracil. We do check molecular testing, for example, next-generation sequencing in many patients once they reach later lines of therapy, because we're really looking for other drugs that may be beneficial. Often that is a consideration before people receive trifluridine-tipiracil or regorafenib, and sometimes it's in planning for after those drugs. I emphasize that the side effects of regorafenib include hypertension, fatigue, diarrhea, hand-foot syndrome. These patients, of course, have all been previously treated, so they've possibly experienced some of these side effects before. We also know what interventions may have helped for those side effects previously. I'm particularly concerned about hypertension, particularly in a person who already has significant hypertension, as we may need to use 2 or 3 agents. We make sure people have a blood pressure cuff at home or have a way of having their blood pressure checked, just so we can keep close tabs on it. And we ask them to bring in those results so we can make modifications in their other medications. This is also an area where it's very important to keep the primary care providers involved in the care of these patients. We know that when somebody has advanced disease, often they don't see their primary care provider very often, but we really need their help with some of the management, such as hypertension. The main side effect with trifluridine-tipiracil is neutropenia. There can occasionally be anemia and thrombocytopenia and mild diarrhea. Now, these are all previously treated patients, and so we already know what their previous experience with chemotherapy has been, and we know what their blood counts are coming into this treatment, so we know how concerned to be about future neutropenia. Fortunately, it almost never causes hand-foot syndrome, so even if they experienced that previously with capecitabine, for example, we don't expect that to be a major problem.